All right, guys, in this video, I'm going to cover extension, rotation, and lateral flexion in the cervical spine. We're doing an in-play assessment of each of those motions. So what I want you to do is you'll use that same kind of web contact that you used when you did the MPI style scan in that cervical spine. You'll have that contact then against your patient's forehead. I'm going to flex her head forward here so that you can see my contacts a little bit better. I'm going to palpate along and find the spinous process of the segment that I'd like to palpate. We'll find that interspinous space. We'll go up one interspinous space and then lateral until we find that area where the facet should be living. And then we're going to use that same concept of extending our patient beyond or right over that contact. We can use this same contact and rotate. So if I want to rotate my patient's head to the right, I can do that, and I'm going to use that contact, follow her rotation, and then challenge it in place. So it looks like this as I'm challenging through and adding that little bit of an extra push with my digital contact. Lateral flexion then is going up into that interspinous space, going through or over to the other side of the spine, finding that spinous process or the lateral aspect of that spinous process. And so in this instance, if I am laterally flexing her to the right, I'll laterally flex her over here to the right, and then I'm going to challenge against the lateral aspect of that spinous process, hoping to feel a glide of that motion segment, that motor unit there, as I'm going through this palpation. So once again, this was an in-play assessment in the cervical spine, showing extension, rotation, and lateral flexion.